There are 3 Medicaid expansion bills. One just goes up to the 138% of poverty, just takes the money under the ACA. One came out of Vision 2020, which is much more complicated. It has some pay-fors in it, meaning paid for the 10% the state would have to do. And the third one is what the hospital said, which is basically give the governor the authority to negotiate a waiver, but tells him he has to do it. The bills are all set for hearing next Wednesday, March 18th at 1:30. That's for proponents. Thursday the 19th will be opponents. And I'm very hopeful. The governor's made comments several places that he will sign a Medicaid expansion bill if we can pay for it, provide the state's share. As we stand here and talk today, the state of Kansas has lost $446 million in health dollars to our state. There's a lot of ways that we can pick up that 10% that eventually will be our responsibility. Right now, we give block grants for mental illness and substance abuse. We would not need to do that because those people would now have Medicaid insurance. So there's a lot of ways we can do that. The most powerful message that we're talking to our more conservative colleagues is hospitals all across the Kansas, the 127 hospitals, 83 critical care units that are talking about, if not closing their door, reducing their scope of service, particularly in rural Kansas, because they don't have the money, and that Medicaid expansion would help relieve that problem.